Hello everyone, this is Dr. Nikitha Reddy, Consultant Obstetrician, Gynecologist and Laparoscopic Surgeon from KIMS Hospital, Gachibowli.
Hi everyone, I am Dr. Sahithi Balmuri, Consultant Obstetrician, Gynecologist and Laparoscopic Surgeon at KIMS Gachibowli. Today, let's talk about laparoscopy and let's clear some common queries that patients ask all the time in the OPD. So Dr. Nikitha, what is laparoscopy?
So laparoscopy is a technique or a surgery where we introduce a camera into the abdominal cavity to see the organs. For gynecology perspective, it is to visualize the uterus, tubes, ovaries and the adjacent organs like the bladder in front and the rectum behind. So Dr. Sahithi, who are the patients whom you would prefer to do a laparoscopy over an open surgery?
Laparoscopy can be done in any of the gynec problems, like to visualize the gynecological organs, that is the uterus, ovaries and fallopian tubes. It can be done in surgeries like where there is a fibroid to be removed or an ovarian cyst to be removed. It can be done in conditions known as endometriosis. Laparoscopy can also be done in tubectomy surgery, that is family planning surgeries, or in patients where the pregnancy lies outside the uterus, that is also known as ectopic pregnancy. It can also be done for surgeries where removal of uterus is indicated. So Dr. Nikitha, you tell me, why do we prefer laparoscopic surgery over abdominal surgery?
So for a patient's perspective, first of all, laparoscopy is less invasive because it is also called a keyhole surgery. So you either use 2 to 3 holes and the diameter of these holes are less than 1 centimeter in size. So postoperatively, their pain is lesser and they recover faster and they can resume their work faster. Now coming to a surgeon's perspective, the visualization is better. So if you're dealing with conditions like an endometriosis or in conditions where you're already anticipating adhesions, so the visibility is better. You can see if the uterus or the other organs are stuck to each other, and so the surgical precision is better. And also there is a 2-power magnification, just like how we play the video games where the magnification here is way better than an open technique. So Dr. Sahithi, now who are the patients who are fit for this surgery?
So any patient who is fit for general anesthesia is fit for laparoscopic surgery, and the fitness of surgery is generally assessed prior in a pre-anesthetic checkup by the in-house anesthetist. So the patients need to meet the anesthetist before the surgery, and generally for all laparoscopic surgeries we prefer general anesthesia where the entire body of the patient is anesthetized and they do not feel any sensation during the procedure. So Dr. Nikitha, what is the post-operative care like for these laparoscopic patients?
So generally post-operatively we follow the enhanced recovery after surgery protocol. So within 3 to 4 hours after the surgery, if there were no intraoperative complications that were encountered, we start them off with liquids and we start soft diet within 5 hours post-operatively. We should be able to ambulate them within 6 to 12 hours and we should also be able to discharge them in less than 24 hours. If it was a small procedure just like a family planning surgery or a surgery done to assess the tubes just for cases of infertility, we admit these patients at day care surgeries and discharge them within 6 hours. So Dr. Sahithi, now that we've understood how a laparoscopy is performed and why we choose to do a laparoscopy, let's break the bits one by one of what the patients generally ask us. So the first commonly asked myth is that is the tubal family planning surgery better when done through an open technique than in a laparoscopy?
The technique for family planning, whether it is done abdominally or laparoscopically, remains the same. It is only the approach that changes. In an open surgery, we have to cut through the layers of the abdomen to enter, whereas in laparoscopy, we have a small keyhole incision through which we are entering. The procedure inside remains absolutely same. So the advantage with laparoscopy is that there is a faster recovery rate and a quicker resumption to work. The failure rates, whether it is done abdominally or laparoscopically, remain the same.
The other commonly asked myth is that if you were thinking in terms of a cancer and if you're removing it through the hole, now are you spreading it by doing a laparoscopy?
No. So when there is a suspicion of cancer in a case of an ovarian cyst or something, we retrieve the specimen through something known as an endo bag, a bag which is introduced through our primary incision, and we place the specimen inside this bag and we rupture the cyst inside the bag, so there is no possibility of spillage to the adjacent organs.
We are glad that we discussed today about the do's and don'ts and the common myths in laparoscopy. If you have any further queries, reach out to us at KIMS Gachibowli.
Thank you.